Are you, let's say, ignoring any personal signs? Well, I ask that only because I'm so thrilled to welcome Dr. Peter Cohn, who is a respected cardiologist on the medical staff at Charlton Memorial Hospital and physician-in-chief for the Cardiovascular Care Center. Dr. Cohn is an invasive cardiologist who performs diagnostic cardiac catheterizations as well as pacemaker and defibrillator implants. And, well, first of all, let me say good morning, and I hope all is well. Dr. Peter Cohn, welcome.
Thank you for having me.
You betcha. It's a pleasure. I'm going to start with that simple question I've been asking my audience. Are people ignoring any of these signs of maybe a serious medical issue or even a heart attack?
We are convinced that people are. We have seen a significant drop in the census at our hospitals. We would typically carry, at least on a busy week, 20, 30 cardiac patients on our services at the two at St. Luke's and Charlton. Our cath lab would, on average, performing about 12 to 15 cases a day, and we've seen a significant drop-off. Now, some of the cases in our cath lab were what we consider outpatient elective, and we put some restrictions on that, but we did a significant volume of inpatients, patients who were having acute heart attacks that came directly to us from the emergency room, or patients who were having symptoms of pre-heart attack symptoms that would get admitted, and we would then bring them to the cath lab for an angiogram and a stent. And we've seen a significant decrease in those patients. And we know that it's not because all of a sudden COVID cured coronary disease, so the only theory that we have is that patients are just living with their symptoms because they're afraid to come to the hospital.
They feel as though they might get sicker by going into an emergency room or something like that?
Exactly. I think they're afraid to go to the emergency room. They're afraid to be admitted to the hospital because the perception is that there's COVID all over the hospital. And that's really far from the truth. The emergency rooms have done a great job on segregating patients who are suspected versus patients who are not suspected. And then on the floors, both in the intensive care units and on the regular floors, there are separate floors for patients who are positive or suspected positive for COVID and patients who are coming in for other non-COVID issues. So patients really should feel that they are safe in the hospital and they are kept safe.
Yes, we're in touch with the physician-in-chief for the Cardiovascular Care Center, Dr. Peter Cohn. And let me just ask you point blank, the labs are open and they're clean, and they need to see these people who, if they don't call, doctor, minutes can make such a huge difference. Impress on us what I mean by that.
Well, when you're having a heart attack, time is of the essence. And our goal when somebody comes in either directly to our emergency room or via EMS, and they show evidence of a heart attack, we try to get them into the cath lab within 30 minutes. Our goal is door to balloon time which means door to the cath lab to opening the vessel under 60 minutes. And we've done a fantastic job with that. The idea is, and this is a national standard, the quicker you open up a blood vessel in the setting of an acute heart attack, the more damage you limit. The longer you wait, the more damage there is. And I think patients waiting at home or even having their heart attack at home, we've seen a few cases where people have just waited, and then come in several days later, kind of after the fact, and they've had severe damage to their heart muscle.
Yeah, absolutely. Do you think a lot of the fear is because of the constant media references to everything COVID-19? I mean, you can't get away from it, Doctor.
I do. I mean, I think public education is really important, and I think The media has done a great job in conveying the message to stay home, stay safe, social distancing. But I think people have taken that to the extreme and said, well, I'm just going to stay home and not see my doctor, or not call 911 and not go to the hospital. And I think, and this is not just in our area. This is a national issue. It's been on the national news. It's been in the large the New York Times, Washington Post. It's a severe national phenomenon that has cardiologists all over the country very concerned. And it's not just within cardiology. There are multiple instances that I've read about patients having acute appendicitis and severe symptoms, and then coming in with a ruptured appendix and severe abdominal infection. So this is a nationwide phenomenon. That's a direct effect from the COVID pandemic.
And of course, if somebody already has an existing, heart disease, they're even at a greater risk, from complicating that. If they don't go into the emergency room, call 911, my dear listeners. Everybody across the country, you're right, Doctor, is saying that there's just been a huge drop in admissions for heart attack, and this is alarming. It really, really is. I hope anyone listening right now, if you are in that category, please, I hope we can influence you to seek medical advice. And the services available locally, Dr. Cohn, can you tell us about that?
So I think first and foremost, if you think you are having a heart attack, if you're having symptoms of chest pain, shortness of breath, sweating, whether you've had a previous cardiac condition or not, and you're having active pain, you should call 911. Our emergency medical services are there. They have protective gear. They'll keep you safe, and they could rapidly identify a heart attack even in the rescue truck. So they have the capability of doing an EKG, transmitting it to the Charlton emergency room, and immediately identify somebody with an acute heart attack. They've had that capability for a long time. So first step is 911. And once you hit the ER will do an appropriate triage and get you set up and get you safe. So, but again, Phil, I can't emphasize enough. Just as you have said, 911. Also, our cardiology offices are open. We're doing a lot of telemedicine and telehealth. We're doing some televideo, but we're also, if somebody really needs to be seen, now again, I emphasize, if you think you're having a heart attack, call 911. But if you're one of our cardiac patients and you're having some symptoms, you're a little more short of breath, you're developing some swelling in your legs, signs of fluid buildup, you should call our office, call any of the cardiology offices of any of the practices, and speak to your cardiology provider. We've had instances of some of our patients who literally we've talked to on the phone, and they clearly should go to the hospital. And we had an instance where some of these patients, we spent 20 minutes on the phone trying to just convince them to go to the ER. Case in point, and some of these people have come in and they've had their lungs full of fluid. They should have gone in 3 or 4 days before. We've been able to save them, but if they had gone in or even just contacted us even earlier, we might have been able to avoid problems.
Dr. Peter Cohn, thank you. Hopefully we can save some lives with this broadcast. Physician-in-chief of the Cardiovascular Care Center, and just so respected. And Dr. Cohn, thank you from our hearts, no pun intended, for being here and for covering this very important issue. Thank you.
Thank you so much for having me.
You betcha. Dr. Peter Cohn.